Bob, I think your shades looks just absolutely fantastic. And of course, a lot of gear for the race, for runners. You can find that here, but you can also find a lot of doctors. And one of them who is here is Dr. Elisa Schulman, a plastic surgeon, and she joins us now. Thank you so much for coming to talk to us.
Thank you for having me.
This is a great event. Why would you come out to an event like this and talk to the folks who come here?
Well, I like to educate people knowing that plastic surgery is for everybody. And you could be very healthy and run, but you could still have some extra skin or some extra stubborn fat. And there's nothing wrong with taking care of that with plastic surgery. You work so hard to keep your body in shape. This is just another extra thing you can do. And it really is. It's very approachable. It's very doable for most people.
Now, we hear so much about the new, trendier cosmetic surgery things, the mini lift or the lunchtime sorts of things. You're not going for that with your patients.
I'm very much a traditionalist. I think the mini specialties, the mini lifts, the mini procedures, they're fine if you have very little that needs to be done. But if you really have extra skin and extra fat, that's where surgery comes in, and that's what I love to do the best.
So how do you do that?
Well, you either remove extra skin by cutting, or you suck out the extra fat. It's a very tiny incision. These are very little downtime. You know, you do it safely. You do it in a regular surgery center with an anesthesiologist. You don't cut corners. And you're very realistic with your patients. You spend a lot of time talking to them. What do they want out of surgery? Are they maintaining their weight now? Then they should be able to maintain it after surgery. How much downtime do they want? I mean, if you've worked so hard to look good and maintain your health, this is just another nice thing to do for yourself.
Who is your typical patient?
Oh, I would say 30s to 50s, maybe had a few children, and not just women. I mean, certainly the post-baby work is very popular. The breasts tend to sag, the belly tends to be a little loose. But for men, they work out and they still have the love handles, or maybe because of age or weight or even medication, they have the male breasts, which really restricts how much you can go without a shirt. And I love taking care of that for men because they're so happy afterwards. And then they come in with tan lines, and then I know they're happy.
Looking all buff, and then they can go and run in the marathon without the shirt on. What are some of the hot trends that you're seeing?
Oh, still making sure you're eating healthy and staying healthy, working out. I love Pilates because it really shapes the body after liposuction. Skincare in general is never going to go out of style. I think everyone understands Botox. I think there's a great preventative medicine in Botox because if you start to get the lines, you can prevent them from getting worse with Botox. I think they also finally realized that a youthful face is a fuller face. You don't want to be gaunt. You don't want to be too skinny. You want to keep a few extra pounds on to look youthful. I mean, youthful is round and plump and soft and not hard and bony. And so that's where I think they're finally realized that people look better when they have a little extra fat. So if you lose too much weight and you're going to look gaunt and older, keep that weight in your face and let me take it off your hips. And then you don't have to worry about looking too thin.
So you take it off the hips, and then you are sculpting the body and making a big change in these people's lives. And you and I were talking before we went on, and you were talking about how the kinds of procedures you do, you feel that they last longer than some of the more temporary.
They do. I think Hollywood, unfortunately, you see a lot of the smaller procedures done in Hollywood, and I think that's fine if you can do them between movie takes or things like that. But I think a real person, you know, works hard for their money, wants to see a real result for what they've done. And the smaller procedures just don't last. They're not meant to. And you can do them every couple of years if you can afford to. But my patients save up and work hard for these surgeries as far as, you know, cost and risk and benefit. And I want to make sure they get the most for their money. So I prefer to do the ones that really have lasting value.
All right. Well, Dr. Elisa Schulman, thank you so very much. We appreciate it. Just one of the many doctors you can come and talk to if you're here at the ABC7 Health and Fitness Expo. And after the break, we are going to talk about vitamins. Stay with us.